Hello to all of you, and welcome to the sections of Breaking Bad News in Ophthalmology. I'm Dr. Yong here, one of the lecturers from the Department of Ophthalmology in UKMC. This section of Breaking Bad News in Ophthalmology will consist of 3 parts. So the first part is the narration slide that what you are listening to, so please listen carefully for this lecture. So after this, you will be required to watch 2 videos regarding how to break the bad news in ophthalmology as well. And then lastly, you'll be given a task. Basically, it's a case scenario, and also there will be a few questions that you need to answer. Breaking bad news in ophthalmology is basically the same as breaking bad news in all other disciplines. So what I'm going to tell you in this lecture is what, why, and how. What is bad news? Why you need to learn how to break bad news, and how to do it. What is bad news? Bad news is defined as information or news that is adversely or negatively affects one's view of future. In ophthalmology, reducing visions or loss of visions is one of the examples of the bad news because it will disturb and also affect their living and also their life. The other example is when you diagnose a patient with a chronic disease like glaucoma that require lifelong medications. This is also an example of bad news as well because it will affect their views of the futures because they know that they will be a burden to their living in the future. So next thing is about why. This is not why you need to break bad news. It's about why you need to learn how to break bad news. One very important concept is from now you have to aware that breaking bad news is an essential skill for a healthcare worker. No matter who you are in the future, whether you are oncologist, whether you are ophthalmologist or general practitioner, breaking bad news, which is health-related bad news, will be an important and also something that you are unable to avoid in the futures in your career. But do it correctly and also do it rightly from the very beginning so the patient able to perceive the information very well from the beginning. You have to improve the disease journey and also the experience for both patients and caregivers. It will also empower patients or related persons, as for example their family members, for the decisions related to the treatment process. Be able to facilitate patients-doctor discussions and decisions. It will also help you as a doctor as well to discuss with the patients for their future journey in the treatment and also in the management. Next, come to how. How to break bad news. Breaking bad news definitely is not just doing talking. It's a procedure and also the skill that you need to really learn. It's same like a IV cannula, how to insert the IV cannula. So first of all, you will know the theory about it. You know where is a vessel located in your body. And then next is you observe how the procedure done from your senior. Then the next thing, usually you do it under the supervision of your seniors, consultants, okay? And then when you become very confident in doing so, then you're able to deliver the bad news effectively. So this is a learning process. It's not something that you can straight away do it because you know that by doing it not correctly, it's just that like you're doing a procedure to a patient incorrectly, you bring more harm to the patients instead of the good. So again, this is a process of learning. First of all, you need to really know the knowledge. That's why you are listening to me now. And then you start to observe, do it with supervisions, and then perform it, and then further improve it, even though you are already quite familiar with the procedure. Now comes the proper how to break bad news. There are many protocols around the world for healthcare workers to remember and also to familiar with breaking the bad news procedures. Spikes, A, B, C, D, E, and bricks. I don't think you all need to remember what it stands for. Basically, later I will let you know that all of them actually hold the similar principles, but they just put it in a different way so that people will easily remember. So all these different protocols at the end share the similar principles. The first thing is about the preparations. The next thing, you will shift the focus to the patients, and then it followed by delivery of the informations, and then after this you need to react to the response, and at the end you need to summarize the process. Okay, now we will go through it step by step. So the first step is about preparations. What do you think is the most important thing for you to prepare? The most important thing for you to prepare is to prepare yourself before you go into the patient. So you must know the patient well, also know about the case, the disease, and the options of the management and also the treatment for the patients. The next is know the progress and also the previous discussions. See back the old notes to see whether any doctor or any other people from other team have already given some information to the patients. That is not a good thing for you to just keep repeating the bad news to the patients, even though someone has already done so. And lastly, prepare your time and also the schedule. Most of the time, we will advise you to mute your phone and also put your phone in the silent mode so that you will make these sessions uneventful and least disturbance as possible. So the next thing to prepare is the setting and also the environment for you to break the bad news. So it should be ideally done in the private room with all the relevant persons that involved in the care of the patients. So you should call in the supporting staff and also your colleague from other team. They're able to give more information related to their field. And the patient should able to call in whoever that is involved in the care in the future, especially their direct family member. Sometimes you may need a translator if you have a language barrier, because what you need to make sure is to able to give the information effectively during these sessions. After doing all the preparations, the next thing is to shift the focus to the patients. This is an important step that most of the people will overlook because people will rush to give the information to the patients. Always remember, before giving the information to the patients, you need to get information from the patient first for you to understand how well the patient is prepared now. So always remember, this is a two-way communications. Always let the patient do the talking first so you're able to understand your patients much better before you give the informations. So this step can always start with open-ended questions. Just ask the patients, how do you feel now? Anything that you know about your condition so far? So for the patient answer, you should be able to understand your patient regarding their perceptions, the knowledge about the conditions, their expectations, the receptivity of the information that you're going to tell for the bad news, and also the readiness for the patients who receive the bad news. After making sure that your patient is now ready for your information that you're going to convey to the patients, then only you start giving the informations. In any point that you think that the patient is not ready because the most important family member is not around, or because the patient have other things that in their mind that they may not able to get the information from you correctly, you should do it in other sections. When everything is ready, now is the time for you to give the informations. You have to make sure that this communication is effective by giving a clear, truthful, and direct information to the patients and the related persons. Always remember to maintain an eye contact to show your confidence and also to give a sense of security to your patients. Avoid jargon. Always use the language that is understandable by the patients. Try to avoid inconsistency and also uncertainty. You have to recognize that in the management of the many disease, there definitely will be uncertainty. You cannot make sure that this treatment will be beneficial to the patients. Okay, some treatment maybe have a risk. What you need to do is you have to recognize this uncertainty and also convey the information to the patients. The way that you can tell is you can tell the patient, there is an option of these treatments. These treatments will be respond in how many percent of the patients and may not respond in certain group of the patients. Okay, so the patient will be able to get the information right, and also will easier for you to discuss and also make the decision in the futures. And also at the end or during the process of the giving the informations, you have to allow questions and also the feedback. The feedback can be in the form of the verbal and can be in the form of the gestures and also the facial expressions. You know that the patient already starts showing that unable to understand and also unable to follow your discussions. You may need to stop and ask the patients again what the patient's which aspect the patient is not understand, and always allow tears and also the pause during the process. Always give the time for patient to respond to what you are talking. Let's say that you have given a very concise and complete information to the patients and the patient able to understand well, but your task is not end here and please don't leave the room straight away. What you need to do next is to recognize the response from the patients and react to the patients. So now it's about handling of the patient's reaction and also emotions after getting the information from you. So you need to recognize how the patient respond to your informations by recognize the verbal and also non-verbal reactions. The patient can tell you that she or he is very upset or angry now, or they can just become very sad and start to crying. And the other thing that you need to address the confusions. The patient may not have any specific reaction because they are very confused and they may not understand your information so well. So after recognizing all these things, you need to deal with it. The first of the thing is the confusions. You have to make sure that which part the patient is confused so they're able to correct it at that point of the time. And the other thing is for the reaction and emotion that you expected will be happen, especially you know that this is going to something that the patient will feel sad. So you need to show your reactions and also your empathy. It can be in the verbal form. Just tell the patients that, yeah, you as a doctor will try their best to help him or her. And also it can be a non-verbal reactions from you as well. You can just as simple as giving a tissue to the patients. You actually have to calm the patients. After going through all the steps that mentioned just now, so at the end it comes to the summary. This section summarizing is very important so that we will know that what is the outcome at the end of this whole sections. So at the end of the sections, it's very important for you to conclude patient understanding and also the patient receptions. The ideal condition is after one section of breaking bad news, the patients and also the family members understand the disease so well and also able to react it positively. But that is not always the ideal scenario. Most of the time, you may think that there will be a need of the further sections to further improve the patient understanding and also the patient receptions. Never hesitate to arrange for another sections in the future time. So here come to the end of this lecture. So please remember the important steps in breaking bad news. So first of all, preparations, prepare yourself and also the setting well. Then shift the focus to the patients, understand how well your patients and how ready your patients to receive your information during that point of the time. And then give the news and also informations effectively to the patients. So after doing this, remember to recognize and deal with the patient reactions and at the end, summarize the whole process. If you really can't remember anything, please at least I hope you're able to recognize the importance of breaking bad news. Recognize it as an essential skill for you to learn during your career. And also remember that all patients are different. Never assume a patient's thinking or reactions before you talk to the patients. And never go unprepared in breaking the bad news. Thank you. So please proceed to watch the 2 videos that we have prepared for you. After watching the 2 videos, you may proceed to the next slide for your assignment.